requested just to give us a short briefing on the difference between the hand, foot and mouth disease and the foot and mouth disease of animals. We are aware, Principal, have been made aware that the community is getting a bit jittery because they seem to think the two are the same and therefore feel that we are not doing what we should be doing as government. And I do want to reassure the communities that the two diseases are two different diseases and they manifest differently. But Ms. Babungile will then talk to us about that. I must say that I'm here today alone. I should ideally be with the MEC for Education, but because we have a meeting that has been called by the Premier, he couldn't leave that meeting, but Premier allowed me to come here. So I'm saying this because I want to confirm that I have permission from the MEC to be here with you today. Just 3 days ago on Saturday, as a province, we had 36 cases. Yesterday, the number stood at 168, but it has gone up by 27 to at least 195 infections overnight. All of these 27 new cases are from eThekwini district, which have added to the 120 cases that they had yesterday, bringing the total for eThekwini district to 147. eThekwini district is followed by King Cetshwayo district at 25 cases, Uku district at 20 cases, and Umkhanyakude district with 3 confirmed cases. Originally, last week, it was only in the eThekwini metro, and now over the past couple of days, we've seen the cases in other districts within the province. All of these 195 confirmed cases emanate from primary schools and daycare centers. And right here at LENHAM Primary School, which is the most affected school in the province, we have at least 89 cases that have been confirmed. This is why we are here today, to see the situation firsthand, to offer our support to the school, to ensure that every possible measure is being taken to contain the spread of the disease. We have agreed with the management that we will provide support. We've also then made a commitment because the second manager of education has just indicated to us that in fact there are other schools that are affected within the area. So we've then agreed that we will have a team that will be going around the schools in the circuit that will be testing learners. We are very much aware, however, that we need permission from parents for us to be able to do so. So the Department of Education will engage with parents to provide us with that permission so that we are able to test learners probably on a daily basis in the schools that are affected, so that we are able to contain the spread of this disease. Hand, foot and mouth disease. It confuses even me. Hand, foot and mouth disease is a viral infection that spreads quickly among young children, especially in primary schools and daycare centers. It causes flu-like symptoms, painful blisters, and swollen hands. While it is not usually severe, it is highly contagious. The good news is that we can stop it if we work together. We have learned a lot from COVID or during COVID-19 times on the issues of hygiene. Again, the key point here in preventing of the head, foot and mouth disease is hygiene, hygiene, hygiene. As a province, we have faced several health threats before, including COVID-19, as I have indicated, and we've been able to overcome them. This we can also overcome. Now we must go back to the basics that helped us fight that pandemic. And those basics are frequent hand washing with soap and water, no sharing of utensils, cups, or toothbrushes, keeping classrooms and homes well ventilated, regularly disinfecting surfaces, toys, and stationery, and keeping symptomatic children at home. That is important, because if we don't keep symptomatic children at home and they come to school, then they get to spread the disease. So we are really making that call to the parents to say, please, let's look after our children, make sure that we are very observant of them, and should we have an indication that they might be infected, let's keep them at home. You can go to a doctor but you certainly can come to our facilities as a Department of Health. We are ready and we will be able to deal with the situation. These simple, powerful actions can help us contain the situation before it gets worse. I want to thank the teachers, school staff and parents who have already taken steps to protect our children. I am aware that in this school in particular, with the first children that were discovered around the early in the month that they were infected, some of them are already back at school from isolation, and that was as a result of the teachers and school staff that was proactive and was able to pick up the matter and send the children back home. The vigilance, or your vigilance, both as parents and as educators, is critical, but we need to do more. Every school, every home, and every community must take this outbreak seriously. To parents, please, if your child shows symptoms, do not send them to school. We want to emphasize this. If your child shows symptoms, do not send them to school. To the teachers, continue educating our children on hygiene and take extra precautions in your classrooms. And to all our healthcare workers, thank you for your tireless efforts in managing this outbreak. This is not a time for panic, but it is a time for action. Let us not allow this disease to take hold, and the best way to ensure that it actually doesn't get hold is for us to be vigilant and make sure that hygiene is adhered to. By working together, staying vigilant and prioritizing hygiene, we can protect our children and prevent further infections. I assure you that we as the Department of Health will continue to monitor the situation closely and provide all the necessary support. In conclusion, I also want to say to community members, please do not be worried. We are here, we are ready. Yes, we have that outbreak, but the best way to manage the outbreak is not to panic. The best way to manage the outbreak is to make sure that we watch our children. If there's a child that you see symptoms in a particular child, don't send that child to school. Bring them to the Department of Health, and we will indeed be able to assist you and get the child back on it in a very, very short space of time. What is also good about isolation here is that the child doesn't have to be away from school for more than 10 days if they have been found to have the disease. So it is very important that we pick it up very earlier on so that we are able to deal with the fallout thereof. I then will request Ms. Mabongile to just give us a difference between the two, and then we can take questions should there be any.
Thank you, MEC. In terms of the hand, foot and mouth disease, as MEC has said, is a viral infection that is transmitted from one person to the other, and it really is not the foot and mouth disease that we know that normally affects cattle and other animals. Because this hand, foot and mouth, it's not zoonotic, meaning that it cannot be transmitted from humans to animals, and vice versa, from animals to men. So it's a different disease, and as MEC has said, it's a very mild disease, and what makes it a bit different from others, it's the fact is the blisters that are normally found around the mouth, on the sides of the tongue, on the palms and underneath the foot, which makes it difficult for the kids to actually swallow, to actually hold anything and walk properly because of the blisters that are on the soles of the feet and on the hands. So we just want to clear that we're really urging community to differentiate between the two, that foot and mouth, it's